In his home, in the safety of isolation, the days go on without him. Sam Meister, at nearly 98, there may be a lot more to look back on, but he's not done yet.
I don't have complaint about health-wise, but one thing I have complained that with my age, I have to sit in the inside in the house and not to move. I am not a free man.
Other than a trip to the dentist, Sam hasn't left his house in nearly a year. His live-in caregiver, Marisel Evangelista, rarely ventures out either. News that older seniors are next in line for a vaccine is a shot at getting his life back.
How do you feel about the fact that you can't go out?
So I'm listening. If they say I can't go, I'm not going. I'm not going to fight because it's very dangerous if I go out. So I don't go.
Sam, how are you?
All right.
At his age, Sam says, there's not a lot of time left to wait.
How are you feeling today?
I would feel better if I would be able to go out.
Dr. Samir Sinha is Sam's doctor. Sinha is the head of geriatrics at Mount Sinai Hospital in Toronto.
You're my oldest patient who's at highest risk of dying from COVID-19.
Yeah.
So that's why I think you need to get the vaccine sooner rather than later.
He's been advocating for seniors like Sam, who live at home, to be prioritized for vaccination. And it's finally paying off.
I'm trying my best, Sam. I'm trying to fight for people like you.
Thank you, thank you. I feel like I'm in the jail. I'm locked up in the jail.
It frustrates me enormously because I have older patients, for example, who are at high risk, and that maddens me because they're frustrated, they've been doing their part, but they're at high risk, and I've lost patients to COVID. It's not fun knowing that there were things that we could have done to prevent these deaths from happening, and that sickens me the most.
Sinha says seniors have paid the highest price in this pandemic. Delays in vaccinating the elderly in care have already resulted in even more infections and deaths in long-term care homes. And there is still the vast majority of Ontario seniors who live in the community who are the most vulnerable and who he's had to keep fighting for.
Who's actually driving the hospital capacity from COVID? It's older people who get infected, older people end up in hospitals, older people end up in ICUs, older people end up dying.
Yet he says most older people are still uncertain about when they will be vaccinated.
There are 3.5 million seniors across Ontario, and right now they've represented 96% of our deaths. So when you actually realize that we are missing these opportunities to get those who are most at risk vaccinated as soon as possible, that's what concerns me.
Under that pressure, Ontario's vaccine rollout was recently revised. Seniors over 80 who live independently have been bumped up. About 500,000 elderly people are now next in line for a shot. Ontario hopes those immunizations will begin in mid-March if vaccine supply is reliable, and says it will take weeks to get to all of them.
Hi, how are you? Fine. Good morning.
At a certain age, every day matters. Olga Libak is 90 years old and lives alone. A personal support worker comes in a few times a week, mostly to help her bathe. It's not always the same person, and not all workers have been vaccinated either. Olga's son Jaime worries about the exposure, and he's worried too about the mental damage that has already been done.
So Olga, how are you feeling these days?
Panic.
Why do you feel panic?
For me, not too much, but for my children, my great-grandchildren. I am afraid.
Cambian ideas y se ponen al día también de lo que está pasando, ¿no?
Jaime is the only one from their large extended family who is able to come by to check in. Olga misses her other children and grandchildren.
Sad because with my children only I have to talk with my phone, you know?
Mm-hmm.
But no.
No physical.
Yeah.
When you hear your mom say that, how do you feel?
Well, it hurts. It hurts, and again, makes me feel that there is something wrong out there. Because if we're not able to take care of our seniors, the worry, the fear, the anxiety shortens the life of the person. right? And she spoke about it. She said, I don't know if I'm going to be able to see my children or grandchildren again.
Adding to the worry, Jaime is 66, but younger seniors like himself will only get vaccinated after essential workers do. It could be months. As her main caregiver, he's afraid of what will happen to his mom if he gets COVID.
Right now, I'm very concerned. As a son of a senior, as a senior myself, I think we need to be very clear that the seniors in the community need to be the priority now. Because seniors and liver disease have been taken care of. Frontline workers have been taken care of. Now the priority should be on the seniors in the community. And I'm not hearing that from the government.
The emotional toll is draining. So are the other quiet sacrifices.
Hi, Bob.
Hello.
Sir, my sir. It's Bobby.
Hi.
Wait.
How are you?
At Sam's house, dinner usually involves virtual guests.
Hi, Mom. How are you? Hi, Mr. Meister. How are you?
Today, it's Sam's son and Marizel's family too. Marizel hasn't lived in her own home for a year to keep Sam safe.
Okay, Mom. Enjoy your supper. I love you. Bye.
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 I told them that's not permanent. We're gonna be together again. And then I can see them and hug them and kiss them. It's very hard, very, very, very hard. Sometimes I cry. It's not easy.
Happy birthday to you. Happy birthday to you.
As for Sam, he may be next in line for a vaccine, but he's anxious to know when.
I'll be able to come out from the front of the door. I would love to get it.
Happy 98th birthday. We love you.
Today is his 98th birthday, and this is as close as he can get to his family.
We love you.
We'll see you next weekend, okay?
The visit is a reminder, too, that time only gets more precious by the day. Joanna Rumeliotis, CBC News, Toronto.